Ronnie, how are you doing today?
Good, how are you?
I'm doing all right. So my name's Andrew Finlinson. I'm a student of physical therapy right now, and I'm going to be helping you today. So what we'd like to do, well, it looks like you have a pretty nice swollen ankle here.
Yep.
How'd you manage to do that?
I stepped in the gopher hole.
Oh my gosh, you're the first patient I've ever had to do that. What we'd like to do today to help this out a little bit, I'm sure you're feeling a decent amount of pain, is that right?
Yes.
I mean, it looks pretty uncomfortable, but so we're going to try to do a therapeutic ultrasound today. One of the things that will help with is to decrease that pain that you're experiencing, and also help with that tissue regeneration, just to help get that going and get that healed up as quickly as possible. And a couple things we want to check just before we do that. You have diabetes type 2, correct?
Yes.
Okay, so have you had any sensation issues in your feet?
Not that I've noticed.
Or circulation, okay. So just to double check here, are you able to feel these different points all right?
Yep.
Okay, that's good. Have you had any blood clots or history with anything like that?
No.
Okay, perfect. So all we're gonna do is this is the ultrasound machine. So what I'm gonna do is I'll put a little bit of gel just right here on your the side of your ankle here. And I'll just rub this just around the side, just really lightly and slowly just around that area. Just focused in on that area right there. And it'll be an area just not very much wider than this, probably about twice the size of this head here.
Okay.
Just right around that area. And we'll probably just do that for about 8 minutes if that's all right.
Yep, sounds good.
Okay. Just put that. Just a little bit of gel. This might be a little cold.
Okay.
So I'll just warn you in advance. Or you know what, might not even come out. No, it'll come out.
Ooh.
I'll push over the other stuff in the process. Okay. So this right here, this gel, if it decides to come out, it'll help get those sound waves into those tissues there and help get you healed up.
Okay.
So the settings we're going to want to put this at, since you're in the inflammatory stage, we don't want to heat it up at all. So we're just going to do we'll do a 3 megahertz since it's just a superficial area here. It's not very deep in there. And then also we're not going to want too much intensity there. So we're going to go a duty level of about 20%, so it's just going to kind of pulse a little bit. And we'll set the intensity to about 0.5. Like I said, we don't want too much energy into that area, and that'll just kind of stimulate those cells and tissues right in there. And we'll do that for around 8 minutes here. So just when we start this out here, it'll probably be a little bit cold, but it should warm up a little bit as we go here. How's it feeling as far as pressure goes? Is that too hard?
Nope, that feels okay.
Okay. And if at any point it does feel like it's like I'm pushing too hard, or if it's too uncomfortable, too painful, or if it starts to get a little too warm, you just let me know and we can stop this. Still feeling all right here?
Yep.
Okay. All right. So that'll be good here. Okay. And how did that feel?
Fine.
Wasn't too bad there?
Nope.
Okay. Well, hopefully that'll reduce some of that pain that you've been experiencing. We'll get you going on some of the rest of your stuff the therapist has ready for you, all right?
Okay, thank you.
Okay.